Jenny, Kelly, welcome to the Lean Out podcast. How are you?
I am doing well. Thank you. Thanks for having me.
You are most welcome. It's excellent to see you again. We met last year at the Revitalize Physician Renewal Retreat in the St. George, Southern Utah area. And for those who are not familiar with you, tell us about you, about your practice, and about how your work life balance is different from other people in your profession.
Well, I am a pediatrician that lives in Little Rock, Arkansas. And I think general pediatrics is not a very interesting, out of the box field, but the way that I've been able to change my practice has not been traditional. So I worked in a very well respected group practice. And then I had my third child, and it was just not sustainable anymore. I felt like I wasn't doing anything well. I felt like I was doing lots of things, but none of them were in the way that I wanted to be doing them. So I decided to take a step back from practice in 2012, right after my youngest was born. I went back for about 3 months, and that's when it hit me. Like, my practice had been very accommodating. They'd let me cut back a little bit, even more part time, but it still wasn't working for me. So took a break, and then actually didn't go back to medical practice until 2019. Now, in that break, I did found a nonprofit here in town called Girls on the Run. So that's a national organization that I just founded the local council for. I'd actually had an idea to do that on maternity leave because, oxytocin was like making you think you can do everything. So I'm like, well, I'll go back, but I'm cutting down. So I'll do this nonprofit as well. And then realized I'm not going to shelve the nonprofit idea, go back to practice. And then I'm like, well, no, now this isn't working either. So took a little break from everything and then decided, okay, wait, I'll go back and revisit the nonprofit. So I did that. And that for me, as a pediatrician, the nonprofit was so focused on children as well. So it kind of helped me still feel like I was still working toward that purpose, but just not in the same capacity and without the same responsibilities and timelines. I could work on things for that when the kids were taking naps or at school, just not the demands that are required of a clinic. And then as my kids got older and some other life changes happened, I went through divorce, got remarried. I got an opportunity to go back to practice in 2019. So it was a 6.5 year break. It was a unique opportunity. Actually, I was meeting with someone about the nonprofit and kind of explaining to them, like, I'm not cut out for fundraising or, I just believed in the mission of that organization so much. I'd like to get back to medical practice someday. And she worked with Community Health Centers of Arkansas and said, I've got a 1 day a week opportunity, but it's in this very small town I'd never heard of, 80 minutes from my home. So thought about it a little bit, and I thought, nowhere else are you going to get a 1 day a week opportunity to get back into clinical practice, because I was still doing the nonprofit as well. So jumped on that, and the commute actually is lovely. It's a time to kind of refresh and recharge and, think about my day. I see patients, and then I get that same transition time for the drive back. So I've been doing that job 1 day a week in the rural health center in the Arkansas Delta. It's a part of the state that needs a lot of resources and support. There's not a lot there. So um, I think when I was asked about the job, I was told there wasn't a pediatrician for 5 counties.
Wow.
So a lot of people will make the trip to Little Rock, the Arkansas Children's Hospital, but sometimes they just need a pediatrician's opinion and they don't need to wait months for a subspecialist. So that made me feel good that I was able to offer those opportunities for families so that they didn't have to necessarily make the trip over to Little Rock. Anyway, so I did that since 2019. And then in 2021, I began the Andrew Weil Integrative Medicine Fellowship. So completed that in 2023, just because I'd always kind of tried to practice in this way in a whole person approach. And so I felt like more formal training for that would be helpful. I wanted resources. There's so much information out there, and digging through to find credible information about all these things can be tricky. So I wanted, an organized with experts in each field presenting information to me and being able to utilize their resources as I continue to practice. So completed that fellowship in 2023. And then in 2024, opened a consulting practice a quarter mile from my home where I'll offer integrative pediatric consultations. So I don't operate as a PCP because I know I'm not as available as I'd like to be if I agree to be someone's PCP. So it's one of the hardest parts of that practice is people will file an inquiry, oh, we'd like for you to be our child's PCP. And I have to say, I know myself well enough to know if I'm your PCP, I want to be available for you as a PCP should. And that's just not where I am. So a little bit tricky of a boundary at first to draw, but I do know that I don't want to overpromise myself for them or for me. So now I've got this balance between rural healthcare, primary care work, and then integrative consultations. Like I said, very close to home, I can walk. So I get to do a little bit of both and get to spend extra time with those appointments. Will take an hour and a half or so for the first visit because we get to talk about everything. And I'm not limited by, got to see all these patients. I get to have control of my schedule. So I think that's a pretty good summary.
Well, I'm curious about a lot of different things
Mhm.
there in your story, but my first question is, how old are your children now?
Um, since I'm remarried, I also have two stepchildren. So stepdaughter's 26, finishing her final year. Match day is in a week. Going to do psychiatry. Stepson is 23, just recently graduated from college and is hoping to start a new job. He had a job offer in Las Vegas
Awesome.
soon. And then I have an 18-year-old daughter who is a freshman in college. An almost 16-year-old daughter. She is about to start driving in less than a month, which will help things a lot too. It's funny how I think about my career in terms of how many kids will be driving at this point, because
Mhm.
it's just this morning I thought, oh, when Patty's driving, I can do that. So, and then my youngest will be 14 next month.
You talked about the phases of parenthood, and when the kids are younger, it's how many kids are in diapers. And then fast forward to what you're talking about, and it's like how many kids are driving, and then it's how many kids are in the house and how many kids are out of the house and
Yes. Yes.
that
And
sort
it's
of
a
thing. So,
definite, makes a big difference. Yeah.
yeah. Okay. So, my other question related to your current practice is, what does an integrative consultative kind of practice look like? What are people coming to you asking?
Mhm. So the way I usually try to explain it to people, which I wish I had a perfect little package of like an elevator speech for it, but it is one of
Mhm.
those that can be a lot of different things. Most of the time, kids have a chronic condition or set of symptoms that they would like to approach in ways in addition to or instead of kind of traditional medical treatments. So I encourage families to continue work with their PCP. That's where they'll get the vaccines and I'm not trying to replace your PCP, but it's just an opportunity. Like I said, appointments can last an hour and a half. So we'll get into all the details of your day. And one thing that's interesting is because I have so much time with families, sometimes I think the best thing I'm giving them is protected time, not even for me to be, I'm there to facilitate some things, but sometimes the real work happens with the conversation between the parent and child, because I'll ask a question, the child will answer, and the mother or father will say, "Oh, you think that? Why are you worried about that?" Because it just hasn't been something that, and which I can relate to, because at home sometimes we don't stop and have these conversations too. So sometimes that's the one thing that I offer, but it's kind of everything else that contributes to health. So some kids will work on mindfulness. Some kids will work on positive self talk, or we may sometimes we'll do supplements or some botanicals. There's not as much research for children in those things, but my priority always one is like, is this safe? And then is there some evidence that it can be helpful for children? So then I might offer some of those things. We'll do a little bit of lab testing if indicated. Um, so just kind of a little bit broader of an approach.
It's so interesting that you describe it this way because now I can see why you are also within the last
Mhm.
recent past pursuing a master's degree in counseling. So talk about why you decided to add that in.
Yeah. So, in the consulting practice here, very often I was having to add, I have my little sections of um, daily habits about sleep and nutrition and all of those things. And then at the end, it was like other resources in the community that might be helpful. And 9 times out of 10, there's a counselor that I think could help with the situation. So maybe anxiety, it may be family relation stuff. They could use some support there. There's not an acute major problem, but I think that someone with a counseling lens could be helpful. And then I can sometimes see their face like, okay, I'm going to go take my kid to meet someone else new, and everyone's
Mhm.
has been, at least my experience so far, they're always very appreciative of the recommendation. But I know as a parent, and you think, okay, we're going to make a new patient portal and we're going to, just the labor that comes with that. And I thought, if I could learn some of these skills and could help them through these things without having to refer them to yet someone else, I don't know that I'll take over like part of my practice as dedicated to counseling or if it'll just kind of diversify my skill set and I'll be able to use these things when I see kids in that capacity. On the flip side, at the rural health center where I work, if I do referrals for counseling or therapy, there are so few options, especially that will see children. Turnover is high. They have to travel and gas is expensive. And sometimes there's one car for the family and there's 4 kids. And so what are you going to do? Take this one car to get this kid in this appointment? The other 3 can't travel. So in that case, it's just in case there's an opportunity for me to offer counseling appointments there or the same, even there, I get a little bit more time with my patients than I would in a busy practice here.
Right.
Um, so even if I can help them work through some of their things that a counselor would help them with, just because I've diversified my skills. Right now, my focus is on let's learn the material and get the experience, and then we'll see how it'll fit into
Yeah, that
practice.
that makes sense. I
Mhm.
mean, it sounds like it's going to be beneficial no matter how you end up using it. The one thing I can see people asking when they're listening to this is,
Mhm.
how does that work for malpractice? Like, is
Mhm.
there a way that you can wrap it in or, make a comment in your patient contracts or something like that? How does that work? Have you looked at that? Because maybe
I
you haven't really
haven't
gotten
yet.
there.
I
Yeah.
haven't yet because at this point, I don't anticipate doing anything specialized as far as
Mhm.
counsel, like I'm not advertising myself as a play therapist or this. So I think most people would agree that it's within the scope of medical practice to give kids strategies to manage anxiety.
Mhm. Mhm.
It's just for me, I wanted a little bit more specific training for that. But I don't think that I'm outside scope of medical practice with that. Now, if I decided I wanted to do PCIT or something specific, therapy trade, then I thought maybe I just kind of operate like 2 different people. Like maybe I have to have a
Yeah.
practice for medical treatments. And then if I'm billing something as a counseling session only and it's more formally presented that way, then I just follow rules like I'm a counselor.
That makes sense.
And that's one of those things that I'm like, okay,
It's good not to
yeah,
worry. Yeah.
exactly. Right now, I know there's got to be a way to do this,
Mhm.
So
Mhm.
we'll
Well, I
figure
think
it
that
out.
that's a great attitude. I mean, because if you go into something like this with the mindset of, I have a passion for this, I want to expand my skill set, this is going to benefit my patients as is, just no matter what I end up doing,
Mhm.
then you can worry about the details later. But
Yeah.
those kind of details sometimes hold people back. And so I think it's important to say, well, I realize that this could be something that I have to address or deal with,
Mhm.
but, I'm not worried about it right now.
Yeah, that's something that I trust myself to figure out.
Yeah.
And I'll have to get help from people. I'm not an expert in medical legal practice setups and things like that, but um, that's something that I know can be figured out. As long as I'm doing things normal, like I'm not doing anything shady, somebody
Yeah.
can help me figure out how to do it and tie up all of those kind of red tape kind of stuff.
Yes, yes. That's a very good attitude. I like it a lot. So, take me back to the time when you decided that what you were doing was unsustainable. You were in a practice with 3 young children, juggling that practice, made accommodations, worked on getting your schedule to something that might be sustainable, but it still wasn't.
Mhm.
How was that decision to step away?
Um, it would seem to many that I made it in a moment, but I think it had been kind of brewing for a while. I
Mhm.
just hadn't named that yet because probably like you and lots of other women and said, we just deal with it. You do residency. And residency is a month at a time or 2 months at a time, and you can get through, and then "Okay, I'll be on this easier rotation." But I remember a couple moments. One was, "This isn't residency. I'm going in at 4 in the morning to round on babies, to come back and get all mine up and get them ready for school, and then go work, and then come home, and once they go to bed, I'm charting." Like, this is not a forever
Yeah.
thing. You know,
Yeah.
if it was a short burst of time, sure, I can do it. I'm tough, I can do it. But this is not an enjoyable way to live. So, I remember that thought, like, this isn't residency, and it shouldn't feel like residency for the rest of my life. Um, and then in clinic, um, I remember I had sent off some lab. It came back and it was a day off for me. I was actually up there charting. Um, but it came back. A nurse took it to a different physician to review so they could call back. She was trying to respect my time off. She didn't know I was there in my office charting. She was trying to respect my time off. Went to get someone else. And then I just remember thinking, this is not like other people are having to to do more because I'm not able to do what I agreed I would do. And that pediatrician did not complain at all. He didn't at all. And everybody's happy to cover me. But for me, I thought, this is probably the only one I'm observing. This is happening all the time. That, well, she's not here right now. Can you just do this thing? And I thought, I'm creating more work for others, and I don't feel like I'm able to do the job that I've intended to do. But then I feel like the patients also get a little confused, like, "Why is she not calling? Why'd you have to ask this person?" It just felt like I wasn't serving my patients very well, so I went into the clinic administrator's office and said honestly, what I remember saying was, "My marriage, my kids are my job, and only one can I pause and come back to." Um, and that marriage didn't survive, but it wasn't because I put my job ahead of, so I
Uh-huh.
thought to
You
myself,
tried.
I tried, yeah, and so that's all I needed to know was that I can come back to medicine realistically. I can't pause the others and then come back to them later.
Mhm. Yeah, and it's such a hard decision, but I really appreciate you sharing the things that were going on in your head at the
Mhm.
time, and it's interesting to me that you still remember them so vividly.
So vividly. Because
Yeah,
I
that
think also, I mean, we worked toward this goal for how many years? And then to
Mhm.
go, it's not working. It is a lot to, and maybe that's why it felt like one moment, even though looking back, there were probably all of these little things. I remember doing the math when I was charting during lunch break, pumping and being like, okay, right now I'm paying to work with the amount of childcare
Yeah.
costs, but it's an investment in the future. And you can only do so much of that before you realize it's not working for me.
It was a very brave thing to do because a lot of people would just go on and keep doing the triple daycare and the 2 nannies and, whatever it is that people do to make it work. But, when you went through the process of separating yourself from that identity, having a period of time off, and then getting this opportunity to come back, how did that feel? Like, what were the emotions in your head there? I mean, I'm sure it was a mix of positive and negative or, like, kind of fear.
Yes, absolutely. excited because, again, I got to go back to this thing that I had thought for a while may not happen. And I'd always
Mm.
kind of said out loud, I'd like to go back to medicine. But then, especially those first several years, how was that going to look? Um, I had gotten remarried in the meantime. And my husband is, you met him, my
Yeah.
biggest cheerleader. So
Yeah.
I had a
He's an
lot of,
amazing guy.
yeah, I had a lot of good support that I was hearing. Um, so I think that helped me. He was excited for me. He didn't express any trepidation, and he was I don't want to get emotional, but he
Mhm.
was very much like, I'll do whatever I got to do to help you make this work.
Yeah.
Um,
And
so
let me also note that he is an orthopedic surgeon.
he is,
He has his own career.
yes, he is, and he is a
So,
busy, busy guy.
excellent person.
Yes, a busy, busy guy. But so I think that helped a lot, and I have really supportive friends too who were cheering for me and not saying, "Ooh, this is gonna be hard. Are you sure you can do
Mm.
this?" So I think that did help a lot. Um, and back in my mind, I get there and I'm like, "Have I is this gonna be like riding a bike or is it gonna be" so I continued with, keeping up my maintenance of certification and things like that. So I'd done a little bit of pediatrics learning along the way. Um, but it's not the same as being in a room with a patient. And the nonprofit work that I did was with elementary aged kids, so I hadn't been only around my
Way
children. Yeah,
yeah,
I'd been around different kids' personalities, things like that. So that I think could also help kind of bridge that gap. Um, but there is that, what am I gonna miss? And I would be the only physician there on some of those afternoons. So you also missed the whole like, "Oh, wait, I wanna run this by somebody." So I kind of felt like I was an island a little bit, but,
That's
really good
challenging for
nursing
sure.
staff. The nurse that I started working with at that, time had been there for a while and had worked with the pediatrician that had retired, that I was taking his place. Um, so that really helped bridge it too, because I felt like at least the families that were coming in I was a new face, and I had some tell me, "We'll see if we like you," 'cause
Oh,
I've been there for years. So, then I really didn't have to spend as much time, um, making sure the environment was okay. I just needed to work on my interaction with them and then thinking through the medical component. I think it could have been a lot more challenging if I had to go, into a different setting or if it were more days a week even, 1 day a week, I'm like,
mhm.
"Get this done."
I've had people on the podcast before where they were a more procedural based specialty and they had to do retraining of some sort. Like they
Mm,
had to
mhm.
do proctoring or something like that. And it sounds like that wasn't a requirement for you in this situation,
No, no.
which is kind of it's good and bad. I mean, I think that you had this opportunity that where they really had a great need.
Mhm.
So they were willing to trust you to come in on this limited basis. But then at the same time, you are describing a very an established group. You were the new person, but everybody else was very familiar with the inner workings of the clinic and how things worked. And so you could rely on them to help you. And that's great.
And I will add, the nurse that I worked with primarily, it's funny when I came 'cause the outgoing physician, actually, I had worked with him when I was a medical student.
Oh,
So, that was a funny connection. Like, we had a
yeah.
1 or 2 day thing where we did this little project together, and he knew some family member anyway, so he was trying to kinda warm hand off to me, I think, because I think he anticipated that specifically this nurse was going to be very protective of her patients. And
Mm,
so I could feel at first she was a little like, "Are you gonna do right by these people?" And so, soon after, we worked together for a few weeks and quickly understood that both of us really were working together to help each other. And I think she really made a big difference in patient trust of me as well. Because
mm.
after we worked together a few times, she could say, "Oh, yeah, Dr. Healy's coming in and you're going to love her." She would make them believe beforehand that it was worth it to take a try seeing me. So,
That's great. So About your current balance, you have two very different practice settings. One is kind of more primary care and it's rural. And then you have this other more of a consultative practice that is even just a almost like a different set of skills or set of questions that people are coming to you with. What do you find is the best part of this mix? Like, what do you love about mixing these two different things in your typical week?
Yeah, that's a great question. I feel like when you put them together, it's kind of what I would have always wanted practice to feel like. I get the newborn visits, that are very standardized but then I also get so it's like you have to put those things together. Um, and then I feel like it kind of rounds out the practice that I always imagined being able to do. Because I don't have to give up those baby checkups and those sick kid visits and being able to tell a mom, this is about how long we expect it to last. And, just when a mother knows what to expect, they feel empowered. And so in those acute visits, whenever your child is sick and I can talk to you about those things, that pulls something up in me. Whereas if I was only doing the consulting practice, I wouldn't get to do that.
Yeah.
But if I was only doing these visits, I would not get that long look into families. And I will say the families in Clarendon, the Rural Health Center where I work, I've seen many of them for a long time. So it's taken years to get the same um, depth, maybe, but there's longevity to those relationships too. But here I get that from the very beginning, I get that opportunity. And people come to that clinic open and expecting to talk about more than just how long have you had this? What have you tried? So
Mhm.
I get to do a little bit. You couldn't do this here, mostly time based, and you couldn't do this here because I don't want to operate as a PCP here just because I'm not as available as we talked about before.
Is there anything that you've identified or have noticed that is a negative to operating this way, to having these two very different practices that you do simultaneously?
Yes. And it's mostly about time management because sometimes I'll get in a mode of working, like last clinic was a busy, busy clinic, got in that mode. And so then it's hard to shift and get into the mode of the evaluation and the workup of a child from the consulting practice
Yeah, and slowing down.
and slowing down. And because so I see someone and then about 2 weeks later do a follow up visit with my plan. So I have time to kind of think about those kids. I'm thinking about them as I'm driving around town. Oh, I should have thought to ask them this. And I always joke like with the kids, if your mom says, oh, Dr. Kelly thought of something else, it's probably true, but the same thing happens. If you think of something you wish I knew, tell your mom, she'll just email it to me. So I'm always kind of thinking about those kids in those couple weeks between the two visits. Um, and so shifting that back and forth can sometimes be a little bit tricky.
Mhm.
Um,
Yeah, I
but,
see that.
and then if I have several appointments at my consulting practice, those workups take a long time to do. So then if I have a busy clinic in the meantime and I've got charting left over, it's managing that. And then shifting from these notes are very long and these notes are a typical length of a medical progress note, or visit note.
Yeah.
So just the back and forth. That fits my personality pretty well though too. I've always liked to be involved in lots of things.
Mhm.
And then enter the master's program. So my consulting practice, I have an online scheduling tool so people can make their own appointments. And so what I've done in response to that is just taken away some of those appointment slots for
For
school.
your study.
Mhm.
So, we met at a retreat. We did yoga together. We hiked. What kind of things do you like to do in your personal time nowadays?
Um, a lot of those things that you just mentioned. I actually did a hike last weekend with some friends. They call it the Mammoth March. They have them all over the country, apparently. The 20-mile hike, and it rained. It stormed that morning. We were not brave enough for whatever term you want to use, to go out when it was actively lightning. We waited. the very last minute. So that minute was just muddier and sloshier, but it was fun. So we enjoy hiking. I am a runner. That would be my primary thing. I've been injured for a while though. So rehabbing that. I swam this morning, still enjoy yoga, and I teach bar
Oh,
as well,
cool.
1 day a week. So yeah, I'm like, I've noticed a pattern with me. I'll do that a little bit. I'll do that a little bit so that I can still keep my toe in things that I really love. And that's an example of something I took a break from teaching bar at the specific studio when I was doing my fellowship and then came back almost 2 years ago. So I guess that's another thing. If anybody's listening, I'd like them to say, like, to learn just because you step away from something, if you miss it, you can go back. It's not a
Yeah.
bad thing. So
Yes. Yes, that's a great piece of advice. And along those lines, do you have any other parting advice for people who are listening who feel like that they can't make a change because they wouldn't be able to go back?
just that's not
Mhm.
true. And one thing I
Your
think,
mind is playing tricks on you.
yeah, yeah, maybe, and I guess one phrase I've found myself saying recently in a few different circumstances is it's all choices, right? Like we would all love, well, maybe not, but I would love to be an esteemed faculty member researching. Like that sounds appealing, but there's no way I can do that and have gotten the time at home that I had. So it's all about choices, and none
Yeah.
is better than the other. And so making peace with the choice you make and trusting your past self to know that that was the best choice for you in the moment. And then if that's not serving you anymore, you can make a different choice. So trying to frame it as like make the best choice in the moment, think it through, but also trust that you really do know what's best for you. Um, so and you can always pivot if you need to.
Yes. Excellent advice. Jenny, thank you so much for being on the show today. It's
Mm,
been a pleasure to see you again,
good to
and I
see
love
you.
hearing your story.
Thank you.